how much is the degree of scoliosis, because the entire prognosis depends upon that. Cobb's angle. Lippmann-Cobb's angle, one of the most important MCQs of all times. How do you calculate Cobb's angle? I'll tell you. Very simple. Identify the curve. Okay. Identify the most tilted vertebra at the superior and the inferior ends of the curve. Identify the central vertebral body of the curve. Now, what do we call them as? End vertebrae. Now, I'll explain what is an end vertebrae. See, this is the curve that we have agreed. This is the most tilted vertebral body at the top end of the curve. This is the most tilted vertebral body at the inferior end of the curve. They are called end vertebrae. Now, this is called as apical vertebra. Why? Because it is exactly in the center of the curve. Now, what needs to be done? According to Lippmann-Cobb's, what needs to be done? Simple. Draw a line along the superior end plate of the superior vertebral body. Draw a line along the inferior end plate of the inferior vertebral body. The point at which these two lines meet, congratulations, you have a Cobb's angle. I hope you have agreed. So, apical vertebrae, top end vertebrae, lower end vertebrae, superior end plate of superior vertebral body, inferior end plate of inferior vertebral body, draw a line along their end plates. The place where they meet is called Cobb's angle. I told you, Cobb's angle is important to classify scoliosis. There are 7 degrees of scoliosis according to Lippmann-Cobb classification. Less than 20, 1, 21 to 30, grade 2, 31 to 50, grade 3, 51 to 75, grade 4, 76 to 100, grade 5, 101 to 125, grade 6, more than 125, grade 7. If you can remember it, it's good. If you can't, that's even better, because nobody will ever ask you about this classification. All they're going to ask you is identify the angle and what is the significance of this angle. And don't worry, significance I will tell you when we will talk about the treatment component. There's one more thing which is very important we all need to understand here, is called excursion of iliac apophysis. You have to be very careful in listening to this, that as a skeleton approaches skeletal maturity, the ossification of iliac crust starts laterally and proceeds medially towards sacrum. And we consider maturation is complete, the iliac crust maturation is complete the moment ossification touches the sacrum or the sacroiliac joint. Don't worry, I'll give you an X-ray, you'll be able to understand. I'm sure you all know that this is iliac crust, of course. Now, what I have already told you is that the ossification of the iliac crust has to start laterally, and this ossification will advance medially, and this arrow is very well depicting of the same. Now, the moment this ossification reaches the sacroiliac joint, we consider the ossification to be complete. So what we have done is we have taken this entire arc and we have divided that into 5 zones, where if ossification starts, we call it 0, first 25% we call it grade 1, next 25% or maybe total 50% we call it grade 2, 75% we call it 3, 100% we call it 4, and once the ileum fuses to it we call it 5. You understand? This is what is called as a riser's staging. Riser has got a lot of role to play in scoliosis. It has contributed to a lot about scoliosis. So riser staging is all about based upon the excursion of the iliac crust apophysis, starting laterally, proceeding medially, 25, 50, 75, 100, riser stage 5 when ossification is complete and it has matured into ileum. It has fused into ileum. All right. 2 investigations, although I will never advise